Hello, this is Dr. Rajni Mandal from Pathology Watch here with your 3D 3-minute digital dermatopathology digest. Today's topic is hair follicle tumors. A common cell originating in hair follicle tumors is a tricholemmal cell, which comes from the outer root sheet of the hair follicle. These cells show abrupt keratinization and pink to clear cytoplasm with lack of keratohyalin granules. This is a common cell of tricholemmal origin. This is a tricholemoma. You can see here a lobular proliferation of cells pushing into the dermis. These cells show pink to clear cytoplasm due to glycogen. There is sometimes peripheral palisading at the periphery of the islands, as well as a thick pink basement membrane deposition. Multiple tricholemomas are associated with Cowden syndrome. Here's another hair follicle tumor known as a trichoadenoma. At low power, you can see that there are multiple islands of cysts in the dermis, and these cysts are filled with keratin. Many times a cyst can rupture, showing a foreign body giant cell reaction to keratin fibers. The cyst islands themselves are lined by epithelium, and majority of the squamous epithelium lacks keratohyalin granules. And here you can see the concentric lamellar keratin within the cyst. Another tumor is the trichofolliculoma, fibrofolliculoma, trichodiscoma spectrum. These are all different stages of the same tumor. Here you can see that there is a central hair follicle with branches of anastomosing epithelium originating out of the hair follicle. In a trichofolliculoma, these are small anagen hair follicles. In a fibrofolliculoma, you can see here a proliferation of fibrous cells or fibrous stroma that sometimes can have a concentric pattern around the tumor. In a trichodiscoma, this fibrous proliferation is most prominent. The cells themselves, you can see here, are mantle cells, and they do show some peripheral palisading. However, there is no retraction artifact and myxoid stroma surrounding them, which would be seen in basal cell carcinoma. Multiple fibrofolliculomas and trichodiscomas are seen in Birt-Hogg-Dubé syndrome. Finally, we will talk about trichoblastoma, and these are multiple blue islands in a fibrotic stroma. Trichoepitheliomas and trichoblastomas represent the same spectrum of disease. When you see multiple blue islands with a concentric fibrous stroma, then this would be considered a trichoblastoma. Trichoblastomas are associated with nevus sebaceous. So here are your 5 flashbacks for today. Hair follicle tumors, tricholemmal cells, are the most common cell of origin, and they come from the outer root sheath of the hair follicle. They show abrupt keratinization, pink to clear cytoplasm, and lack of keratohyalin granules. Tricholemomas show lobular proliferation connected to the epidermis and a prominent basement membrane in hyperkeratosis. There are multiple associated with Cowden syndrome. Trichoadenomas show epithelial islands with multiple cysts filled with keratin, and trichofolliculoma, fibrofolliculoma, and trichodiscomas are different stages of the same tumor that show fibrotic stroma and anastomosing strands of follicular epithelium. They're associated with Birt-Hogg-Dubé syndrome. Trichoblastomas are multiple blue islands with a fibrotic stroma and associated with nevus sebaceous. That's it for me for today. This is Dr. Rajni Mandal from Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.